The number of parents and caregivers showing up in medical facilities for routine immunization exercises for their children has dropped in the first quarter of the year. This is according to UNICEF Kenya, which says the coronavirus pandemic has created a general apathy among Kenyans in seeking medical services in hospitals. The Africa Center for Disease Control and the World Health Organization is urging governments to pay attention to the other healthcare concerns. Ruth Samway has more.
At the Mukuru Kwa Ruben Health Center in Nairobi, only a handful of parents have showed up with their young ones for a critical immunization jab. This is hardly what this facility is used to. The arrival of the coronavirus has dwarfed the numbers of these routine visits.
The number of children being brought for immunization have reduced to about 40%. Normally we could have numbers of, could see 200 children, 250. But right now we are serving less than 20. When we go up a little bit, 20, 25, compared.
Despite the attempts at tracing and follow-up by the hospital, a majority of the parents have elected not to show up.
We have been doing contact tracing. When we call them, some will tell you they're at home, that is hub country, they have traveled. Some will tell you they have traveled, going to another facility to receive immunization. And a big number, they don't pick up their phones.
Reports show that the coronavirus has brought about a sense of apathy among Kenyans when it comes to hospital visits for these routine checks.
Kwa nimeona kwa news hii corona athari zake na pia signs and symptoms, although ilikuwa nchi za nje. Kwa hivyo naweza sema ya kwamba hivyo ndio niliingiwa na wasiwasi, na labda hiyo ndio imepelekea pia sijampeleka mtoto kupima weight hii mwezi.
Peter Okoth is a program officer in charge of child health at UNICEF Kenya. He says hospital visits for immunization have dropped immensely in the country since the arrival of COVID-19, exposing young ones to the risk of medical complications such as polio, measles, and hepatitis.
Between January and April last year, around 430,000 children were vaccinated, received the 3 recommended doses for most of the vaccines. But between January and April this year, we are seeing that numbers reduced to around 318. So we are seeing quite a drop in across all the vaccines. And this shows that the number of children who would have missed their vaccines over the years is going to increase.
The disruption of global supply chains has also affected availability of critical vaccines.
Currently, the country has all the vaccines except one vaccine, the tetanus vaccine that is administered to pregnant women and also to those who get trauma as part of protecting them against tetanus. So, but this vaccine, which is in low supply in the country, will be arriving on the 15th of May.
Okoth says there's a need to rally parents and caregivers to undertake this critical exercise, especially after the coronavirus is dealt with.
In case there are more children who are not reached, then later on in the year, we are going to have intensified activities to ensure that we get the children who have missed the vaccines. Because failure to meet that have serious consequences for the gains already made in immunization.
But this is hardly unique to immunization. World over, many believe they would be exposing themselves to the virus by visiting the very places it is being treated. This is putting lives at risk, especially in Africa, a continent with weak health systems.
Yes, we should pay attention to COVID-19 aggressively, but make sure we protect those programs that are endemic all the time. So if you combine the death toll that results from malaria, TB, and HIV each year, they exceed 1 million across the continent. So that's very, very important that we have to, at the same time, keep an eye on that and make sure that these programs are protected.
As we work on responding to this pandemic, we must also work harder to prepare for the next one. Now is an opportunity to lay the foundations for resilient health systems around the world, which has been ignored for long.
Health facilities say they have put in place measures to curb the spread of the virus and are encouraging Kenyans not to risk their lives by skipping critical hospital visits.
The government has also equipped the health facilities to safely deliver these vaccines and ensure that the social distancing is observed. So safety is assured at the health facilities.
Ruth Sarmoi, NTV.